a lot of people do request recordings of the meeting, and just to say, we will share the presentations, we share the recording, we share the chat. So just to say a little bit about Carver and then a bit of background about these meetings. So we are what is called an infrastructure organisation. We're here to support and strengthen voluntary, community, faith, social enterprise sector, mainly around funding, volunteering and governance, but we are also the link between different parts of the voluntary and community sector, but also the link between the sector and statutory partners. So that is why we're here today. So we've actually been running these meetings about embedding the VCFSE sector into the integrated care system since January 2022. So before the integrated care system actually became a legal entity in July 2022. So we've covered in that period of time, what is the ICS, what is the role of the voluntary and community sector, what are the health priorities for Solihull. There's been a chance to give feedback into the 10-year ICS strategy, and the last meeting was very much focused on the Fairer Futures Fund. So that's just a little bit of a preamble for me. It doesn't matter if you haven't been to previous meetings, people have sort of joined along the way, which is great. So before I share the slides, just to say, in terms of housekeeping, if you can keep your microphones on mute while people are speaking, that would be very helpful. Please feel welcome to use the chat, which is that you'll find at the bottom. There are also those reactions where you can stick up a hand if you want to ask a question. So I think there's still somebody in the waiting room, Gemma. In the meantime, I'm going to share my screen and hope that that's successful.
Yeah, we can see that, Jane.
Great, thank you. So that was just the housekeeping. So just to say a little bit about today's agenda. So we've got quite a lot of content, quite a lot of presentations. So I'm planning on having a break in the middle. So what we're going to go through today, as I said at the last meeting, we focused on Fairer Futures Fund, but Carol Andrew, who's head of place and partnership for Solihull, is going to give us an update on that. Then we're going to look at integration, community integration, the Community Care Collaborative, and we have Jatinder Singh joining us, who is Associate Director for Strategy and Partnerships for the Community Care Collaborative. Then we have a presentation on the system-wide community engagement framework, and we're joined by Emma McKinney, who is stakeholder and community engagement lead for NHS Birmingham and Solihull, sitting with the ICB, the Integrated Care Board. We're going to have an update on the VCFSE Leadership Alliance, and that's coming from Steph Bloxham from BVSC, who's head of health and social care there. We're going to have updates from the wider sector, including the Mental Health Collective. So later on, we're going to be joined by Evan Grant, who leads that collective, his partnership lead, and then any other business. So you can see it's quite a hefty agenda. So I'm going to move on straight away to Carol, who's going to give us an update on Fairer Futures Fund. So Carol, over to you.
Thanks, Jane. Can I get the next slide?
You can. Yeah, just ask me to go forward and
yeah, will do. Thank you. So yeah, I mean, I'm aware that you heard a fair bit about this last time. I think Sham from Heart of England Community Foundation or someone from there came to talk to you about the small grants scheme. I'm going to give you more of an overview and talk to you about the other part of the scheme today. So basically, this is a system fund. It's managed through place committees, and we have two place committees, one for Birmingham and one for Solihull. And the idea of that is that Birmingham Place and Solihull Place can allocate and manage this fund in the way that suits them best because of the needs in that area. So in Solihull, and we very much focused on improving health and care outcomes for the most vulnerable communities in Solihull. We want it to align to our health inequality strategy. And when you get the slide, there's a link to that strategy in there. We want it to be based on, we want projects to be based on evidence of need. And I've put a link there for you, which is a fairly new set of information actually around what we're calling the story of Solihull, but which is our joint strategic needs assessment for Solihull. So that will give people lots of information about how things are looking in the borough and where that need is. We also have an outcomes framework in Solihull. So the things that as a collective of partners, we're working towards improving outcomes. And I've put you a link to that outcomes framework. And alongside that, we have a Birmingham and Solihull 10-year health and care strategy, which also talks about the things that we're wanting to do over the next 10 years. So really important pieces of information, I think, that set out what we're wanting to focus this fund on locally. We're really, really keen that this has a community engagement and co-production element, and we want the fund to be used to test out ideas and solutions that otherwise would not be possible. So as I've put at the bottom there, it's not intended to be used to stabilise things that we should be doing already, delivery models, plug funding gaps in existing services. This is about new stuff and new ways of working. The project, the local priorities that we're focusing on in Solihull are very much around community integrations, making sure that people can get the care that they need in the community when they need it, so that they're not ferreting around for a long period of time and things are getting worse and worse. We want people to get what they need when they need it in the community as much as possible. We want to have a focus on prevention, so helping people to stay well. So things that the voluntary sector do are really, really relevant to that. Physical activity, keeping people connected, and linking to local community groups, really important to help that mental and health and physical well-being. And then we have a focus on mental health as well. So those are our kind of three kind of headlines, if you like, but whilst also looking at the things that I've put above there in that first section. So that's what we've set out in Solihull. Solihull Place Committee said this is what we want to use this money for. I think it's fair to say that we haven't been specific because we want to have that innovation particularly from voluntary sector, but from the rest of the system as well. So this is about people on the front line, on the ground, the clinical side, really understanding what needs to happen locally. So we haven't been specific for that reason, but we've set out that criteria. Can I have the next slide, please, Jane?
Yep.
So we've got two pots of money, if you like. We've split our funding into two bits. Small grants is the one element, and then the other element is what we're calling early implementers. So the small grants bit is the bit that Heart of England Community Foundation would have spoken about at the last meeting for those of you that were here. And just a quick recap on that. There is up to £10,000 available for voluntary organisations that have an annual income under £1 million. Now, initially this was annual income of less than 500,000, but we've increased that to £1 million. That means that small to medium-sized organisations can apply for this fund. Projects need to be completed within 12 months from the commencement date, thereabouts, and all of that, as I say, is being managed by Heart of England Community Foundation. And I've put a link there to their website where you'll find the details, how to apply, etc. Really importantly, and I think this has been a really good move, is that we haven't set a deadline. We haven't sort of said, right, okay, everybody needs to get their applications in and they all need to be in by this date and then that's it for the year. This is applications accepted monthly on a rolling programme. So last time we met, we've got a panel that meets every month. Last time we met in July, I think we had 3 or 4 applications, and this time we've got a fair number, but we know that there are more coming in month on month. And so that's a small grant scheme. Next slide, please, Jane. And I'll tell you a little bit about the early implementers scheme. So this is for larger amounts of funding that are available for 2 or more organisations working together. And one of those organisations must be from the voluntary sector. That doesn't mean that there can't be 3, 4, 5 organisations, but we are saying at least 2, and at least one of those must be the voluntary sector. We're currently working up, we're nearly there with it really, the specification and the application process. We did a little bit of an exercise, which is about kind of understanding the market to test this process out. So we've learned quite a lot through that process, which has given us a really good steer for what we need to put in the specification. And we're due to launch that early October, with formal bids being due 20th of November or thereabouts, with a view to then making awards in December. Really important to note that the formal process, although we'll put out comms around it, that it will be launched through the CSW JETS system, which most of you will probably be familiar with. It's managed through the council, and that's the system that they use for their tenders and for their procurement. So if you're not registered on there and you are interested in this fund, then you need to get registered, because that's how the information will go out. It will also give you the opportunity to kind of find out what's happening when, and if there are any questions. They have a kind of FAQ section on there as well. So if someone asks a question, you'll get the benefit of the answer. And obviously communication about that will go out through the Carver network as well as other places. Same criteria, the criteria hasn't changed. I think one thing to say is that when we did this little market shaping exercise, we had a lot of organisations that came to us and said, we'd like to do this and we'll be working with the voluntary sector, but they hadn't really specified who that was or what that might look like. So opportunities, I think, for you to do some networking and thinking about how that process might work. Okay, next slide, please, Jane. I think there's one more.
That's the only one.
Is that it? Carol, is that the end of it? Okay, yeah, fine. So that's a brief outline. I'm happy to take questions if there are any. I can't see the chat. I can't see the chat at the moment. So
we've got one in the chat, Carol.
Yeah,
from Nabila. They say, can recipients of the smaller grants be one of the named partners for the Early Implementers Fund?
Yes, because I think they will be allocated separately. So if you've been awarded a small grant, that doesn't stop you from entering into a partnership with another organisation for early implements. Absolutely, no problem with that at all.
Thanks. There aren't any other questions in the chat at the moment.
Any other questions from anybody? If you want to come off mute, feel free just to ask Carol a question. Otherwise, put something in the chat and Gemma will pick it up.
Hi Jane, yeah, I did put it in the chat. Does it need to be, when you say partners, because we're forming a partnership in Hall Green and they're mainly all community organisations, so does it have to be somebody from health within that partnership, or can it just be community organisations? It can just be, because you're 2 or more organisations coming together. So yeah, absolutely. Great, thank you then. Yeah.
And
the amounts for the larger fund, there aren't any. We haven't set any amounts for the larger fund. We have got 2 million badged against this early implementers element in total. That seems a lot, but it's not. So, but there isn't a kind of set amount. We haven't made that decision. We have got, in Solihull, we have got 4.2 million in total until 2025. So we've got 2 million against this year. And what we wanted to do was to look at what came in and give us the opportunity to maybe steer things towards any gaps in future years. So that's why we've done it this way. But I will say this is a learning process. You know, we've never really done this kind of thing in this way before with this amount of money. So we are learning all the time. Will the early implements work need to be Solihull based only? So there is, I can't remember what the wording is around this, but it is, it needs to be to the benefit of Solihull residents. So what we are looking for is organisations that already have a presence in Solihull. So what we don't want is somebody from outside of Solihull coming in and as a new organisation to deliver something for local residents. So we are focusing on organisations that already have a presence in Solihull to support Solihull residents.
Okay, any other questions?
Is any of this fund going to be used to maintain existing council? No. So as I said in that criteria on the first slide, this is not about propping up existing services or gaps in funding. This is about new and innovative things. So no.
Carol, you mentioned that you're happy to, or you're encouraging feedback and, you know, open to sort of learning on this. If people want to give feedback, should they do that directly with you or somewhere else? And if it's with you, are you happy for us to share your email address when we send out information after the event?
Yeah, happy for you to share my email address anyway. That's not a problem. I suppose it depends what that feedback is about. So we've done the market engagement process now, and we're looking at the spec, and that will be launched within the next couple of weeks. So I think that it depends what kind of feedback it is, I guess, Jane, because what we don't want is somebody going, well, why have you not decided to set one of your criteria on, I don't know, bouncy castles, when actually we're too far down the line. We've had all of those decisions made at place committee now. The criteria is set. I think if there's something around the process that we're missing, I mean, we certainly had feedback about why were the small grants only at organisations of 500,000 or above, and we changed that to 1 million because we've listened to that feedback. So I think if there are things like that, then yeah, we'd be more than happy to hear it.
Brilliant. Thank you ever so much, Carol.
Pleasure.
Okay, so before I introduce Jatinder, I just wanted to remind you of the Birmingham and Solihull integrated care system. So we're one of 42 systems across the country, came into being July 2022 and replaced clinical care commissioning groups. So you can see there's 5 places for Birmingham, 1 place for Solihull. So in these meetings, we have primarily focused on the system. And one of the purposes of this meeting is that we have 2 representatives who are with us today. So we have got Chet Palmer from Coalbridge Trust and Kerry Turner from Citizens Advice. And they are representatives into the Voluntary and Community Sector Alliance. And there are also representatives from those other areas of Birmingham. Then the connection from the Voluntary and Community Sector Alliance to the Integrated Care Partnership is currently through the chair of the Voluntary and Community Sector Alliance, Stephen Raybould, and there's also the Integrated Care Board. So we have very much focused on the system. But now the focus is very much more on the neighbourhood integration. So Carol has mentioned we have Solihull Place, so that comes into place. But now it's thinking about practical integration in geographical areas. So Jatinder is going to take us through what that looks like for Birmingham and how we can begin to think about that for Solihull. I think in previous meetings, we have talked about in Birmingham, there's a neighbourhood network scheme and there's not an equivalent for Solihull. So we need to think differently in Solihull, but it's good to know what is already happening in Birmingham. So I'm going to pass over to Jatinder and his presentation. And he also unravels a lot of the terminology about place, localities. So he's going to take you through that. So I'll pass on to Jatinder.
Thank you, Jane. If you can go on to the next slide. So it just explains what I'm going to go through. So I'm working mainly on the Birmingham side of the Community Care Collaborative, and Carol is working on the Solihull side. So I'm going to just, what Jane has asked me to do is just give you an update on the stuff that the Birmingham people are focusing on at the moment and where we are at the moment. And this is just to help you to think about how you could develop things in Solihull as well. So I'm going to go through the Community Care Collaborative, its purpose, what we're doing in integrated neighbourhood teams, give a brief overview of the system, place and locality footprints, and what we're doing in engaging the voluntary community sector in Birmingham, and some questions for you to consider. Okay. Next slide. So the Birmingham and Solihull Community Care Collaborative is very new. It's in its infancy. We haven't even had our first steering group meeting. That's scheduled for the 25th of September. So, and the purpose at the moment is defined as I've put on this slide, is for Birmingham Solihull Community Care Collaborative to come together to look at integrated care at place, locality and neighbourhood level to support the community to stay healthy. There is talk about eventually having some sort of delegation of budgets. What that will be hasn't been decided. That's all to probably be in the future, in the next few years, really, not very soon. The initial scope is looking at bringing together primary care, social care, community physical and mental health care, and voluntary community faith and social enterprise sector, secondary care as well, care coordination in the communities that we live in. And we're focusing on integrated care for adults at the moment. There is a separate Birmingham Children's Partnership, which will also look at the children and young people's agenda. Next slide. So overview, Jane asked me to just go over this quickly. I think some of you have seen this before, so I won't go into too much detail. Next slide. So as the system is Birmingham and Solihull Integrated Care Partnership, and you got a Birmingham Solihull Integrated Care Board as well. So that's the system, you could say. At place, we've got Solihull Place and Birmingham City Council. And if Solihull is unique, it's also not a locality but also a place, so it's duplicated as a place twice, really. Within Birmingham we have 5 localities, and the locality partnerships are still in development, and I'll explain that a bit later on. And we're looking at developing neighbourhood teams, integrated neighbourhood teams within the footprints of the PCNs, primary care networks, which are already established. So we talk about place, locality, neighbourhoods in BC, and the people that live in the place and locality, neighbourhood and services within those different areas. So you could have system-wide services, locality-based services, or eventually some integrated neighbourhood team services being developed. We're looking at local assets and building on what we've already got. Next slide. So what we mean by system is everything under Birmingham Solihull, which is quite a wide range of things. So it's obviously the citizens, the patients, carers that all come into the system. Community health services. So in Birmingham Solihull, you've got 2 different community health service providers. The community organisations and voluntary groups. We've got in Birmingham it's BBSC, who's the umbrella body, and Carver in Solihull. You got different acute trusts in saving the Birmingham population in Solihull, and West Birmingham also has borders with Sandwell West Birmingham hospitals as well. So it's not a simple picture when we start talking about the system. Mental health services as well across Birmingham being delivered in a system base, and primary care GPs, as we know, and the primary care networks are all set up differently as well. Public health and social care. Next slide. So by place, we talk about Birmingham Place and Solihull as a place. They're 2 different places, and they've got different 2 place committees within the system, which have the authority to delegate services, but haven't at the moment, and are looking at how they can improve the commissioning of services. Next slide. So place-based partnerships are responsible for arranging what is delivered to health and care services. They identify and set objectives, as Carol already mentioned. The key criteria and the key objectives for Solihull have already been decided. Similar with Birmingham, a 5-year forward view has been published recently. They bring together system partners, looking at focusing on preventative and proactive support and joining up care. The key thing now is that we're going away from competition and more about collaborative working across all providers, rather than previously, before this new Health and Social Care Act came into place, there was a lot of potential competitiveness between different service providers within the health services as well. Next slide, please. So this is just an overview of the different localities in Birmingham. So we've got North, West, East, and Central and South. You can look at the detail later on. Next slide. So the locality partnerships are still in development, and I'll tell you where we are with them in a bit in the next few slides, but they will be the key in delivering health and care services tailored to the people that live in those localities. We will be using an evidence-based, data-driven way of understanding the health needs of those areas. Public health has been quite helpful in Birmingham to get the locality profiles already in place. There could be a budget in the future. No budget has been set at the moment for localities, so it's already early days. Can't see that happening for another couple of years yet, because we're still in the infancy of locality partnerships development. They will bring all the different service providers I mentioned earlier together in a locality, and there can be a forum for citizens and communities to be represented as well at a locality. Next slide. So what do we mean by neighbourhoods? So a group of GP practices are coming together as primary care networks, which you're already probably aware of, and in a locality there can be a number of primary care networks present. So as you can see, the slide tells you how many in different areas of Birmingham, Solihull. Next slide. So integrated neighbourhood teams, where are we in Birmingham? There's 5 prototype sites that were identified early in the year. So the prototype sites I've mentioned here, which primary care networks we're working in at the moment. So in North is King Stanley, Edgerton, and Newchalls. In the East is Portley East PCN. In the West is Modality PCN. South is Harborne, and in Central is mostly Bilsey and Yardley Wood PCN. This has been led by our Chief Officer for Transformation at Birmingham Community Healthcare, Chris Holt, and his team. And we're looking at accelerating the East and West integrated neighbourhood teams. Next slide. So as we speak, the East and West integrated neighbourhood teams are testing this framework out. So as on the left-hand side, you can see the different players that will be in the integrated neighbourhood team. So you will have a GP rep, the mental health people there, a neighbourhood expert, community nurse, OT, social worker. So we're trying to get all the different players on a neighbourhood to come together on a regular basis. In East and West now, they'll be meeting on a weekly basis at least, to look at data to see what are the high intensity users for all the different services, which residents or patients are coming into all these different services on a regular basis, and how can we coordinate their care better. So that's why we're looking at developing a integrated neighbourhood team coordinator who look at ensuring the case management and the smooth running of the meetings and looking at action logs. A neighbourhood expert, they're testing this differently in East and West. East are using a social prescriber to do that neighbourhood expert role, and in the West it's a voluntary community sector person has come forward to be the neighbourhood expert. So this is all being tested as we speak. They only went live last week, I think, so it's very early days, and any new learnings I could bring that to this forum in the future as well. Okay, next slide. So voluntary community faith sector engagement in Birmingham, we have the Birmingham Voluntary BVSE, who are present today as well, who attend the Community Care Collaborative Steering Group as well, and they also do engagement with the localities as well to keep them up to date with the developments. In the West locality, we've got an organisation called Flourish that has already set itself up and has become a voluntary community faith sector umbrella organisation for the West locality. The North locality are also looking at possibly developing something similar to Flourish. And Central, East and South have no collective at the moment, but they could possibly develop something like that in the future as well. So in Birmingham, each locality may eventually have, you could say, VCSFSE being the one system place, and then a locality basis, you may get voluntary community sector organisations coming together, umbrella bodies being organised. Next slide. So each voluntary community faith sector organisation needs to consider. These are questions for you to now take away, not necessarily to answer today, but as a forum, I think you need to think about. So in the BSOL system, you could engage through Warwick and Solihull Calva as you are now. In the Solihull place, then you need to think about, okay, do you want to develop something which is just Solihull focused, and so like we're developing some other in the localities, but these ain't for me to decide. These are just questions for you to think about. I'm not saying you need to go in anyway or not. Also, if you're working on a neighbourhood level, how do you engage with the PCNs at the moment? How are you working with integrated teams? Carol probably know more about this at the moment and how people are engaging and working with the PCNs. I'm not. Carol is the main lead for Solihull, not myself. And do you know those social prescribers that work in your PCNs at the moment? So these are just questions for you to consider going forward. Next slide.
I think that is
That's
it.
Yeah,
I think that's your last slide.
Okay. Any questions on what I've mentioned?
Any questions for Jatinder? Thank you so much, Jatinder, for taking us through that complex landscape and making it simple. Any questions on any of that?
If you think of anything afterwards, just Jane, you can share my email address and people can link up with me afterwards as well if they want to.
Okay, thank you very much. Carol, do you want to update on anything Solihull related in terms of community care collaborative? I know it is very early days, isn't it?
It is early days, and I think we've had a couple of updates at this meeting on things that we've been doing in Solihull, and because we've now agreed that we will work as one system. We had originally at the beginning we had two, well, they were called community integrators at that point. We had two community care collaboratives, one for Solihull and one for Birmingham. We've brought those together now with BCHC leading those. And so there are lots of there's lots of thinking that's going on at the moment, and planning and working things through to get that kind of roadmap, I guess, of where we're going to go with this in terms of our health services, but also in terms of how we work with the voluntary and community sector. So we've got another workshop coming up. I can't remember when it is, 14th September, that Jane, you're coming to. Are you coming to the second one?
I can't come to that, but our CEO Karen Winchcombe is coming.
Fabulous. Okay, and Karen sits on our Solihull Place committee as well. So I think once that second workshop has happened, we'll be a lot clearer about how we're going to take things forward from here on in. Having said that, there's lots of work that's going on already particularly around urgent care pathways and how we, as I said before, support people at the right time in the community, which is why we're kind of keen that some of those wider, more services, the voluntary sector services, support that to keep people well. So it's all coming together, but it's not, I don't feel we're at a position at the moment where we can come and be clear enough about that.
Thanks for that. And do you think, Carol, I mean, Jatinder's sort of posed a few questions for voluntary and community sector to think about in preparation. Is there anything else that you think it's good for organisations just to be thinking about to get themselves ready for whatever is going to happen in the future, or is it too vague at the moment?
No, I don't think it is. I think if you keep the simple thinking really simple, what we are trying to do is keep people well, aren't we? That's what we're trying to do. And again, going back to the Fairer Futures Fund focus, this is about the things that the sector does that will help people to stay well physically and mentally. So, sometimes I have heard people say that health doesn't recognise what the sector does enough. So I think being able to articulate what you do in terms of how that keeps people well it is going to be really important, because that might not always be viewed as something that, you're kind of doing it under the radar, I think. So it's a bit of blowing your own trumpet, isn't it? And recognizing what you're doing to support people. Does that make sense, Jane?
That does make sense. And actually, we've got a bit of a slot on the agenda for anybody to kind of share any information on, any good examples of integrated working that is happening at the moment. So we'll go on to that a bit later. Just want to check if there's any questions for either Jatinder or Carol before we move on. Anything in the chat, Gemma?
Not that I can spot at the moment.
Okay, I think it is fair to say, which I think, Carol has emphasised, it's a work in progress. It's still very much in its early days. So we will keep updating you on progress. Okay, on to the next agenda item. Thank you very much, Carol and Jatinder. We're going on to the system-wide community engagement framework, and Emma McKinney is going to give us an update. But just to say, before Emma came into post, there was some consulting by Morehouse Consulting on behalf of the Integrated Care Board, which began to look at design principles and components of a community engagement framework and some recommendations. I believe, but Emma will tell us that that's going to the ICB for approval in September. But over to Emma, because she will update us.
Thanks, Jane. Hello, everyone. Yes, as Jane has alluded to, I am fairly new to the NHS. I joined NHS Birmingham and Solihull Integrated Care Board in June. I'm part of the ICB's communications and engagement team, and I lead all of our stakeholder and community engagement activity with my colleague Helen Smith, who is also very new, newer than me to the ICB. So at the moment we're starting to build our networks and contacts across the systems. I'm looking forward to getting to know various people over coming weeks and months, and be happy if Jane can share both my contact details and Helen's details with everybody here, so everyone can start making contact and we can start building those relationships. So it's pretty much a twofold role, really. One that we engage with our political stakeholders, trying to ensure that they're advocating for us and our vision and our ambitions for the future, and then the other side of that work is patient and community engagement, particularly when we're looking at changing patient services. So one of my priorities, as Jane has said, is implementing a new engaging with our communities framework, and building on some of that work that has already happened before my arrival. So I'll come on to that a little bit later. If Jane, if you could go to the next slide, that would be great. So just to give you a bit of background information, as Jane has said, ICBs are relatively new. We placed CCGs in July 2022. In March this year, we published our 10-year strategy, which essentially sets out a really big and ambitious vision to make sure that the people of Birmingham and Solihull are living longer, healthier and happier lives. So the strategy itself actually was developed following extensive engagement with our citizens, partner organisations and staff on the front line. We worked closely with, for example, Solihull and Birmingham Health Watch groups, and other voluntary group sector organisations to really utilise their trusted and existing relationships that they have with the communities to shape what our 10-year strategy looks like. So those of you that don't know, that last autumn NHS England released updated guidance on community engagement, what that needs to look like, and some statutory and legal requirements around community engagement. And in response to that, as an ICB and as a system, we published our Working with People and Communities strategy, which aligns to our 10-year vision. It essentially recognises that we've got a real opportunity here to reshape citizen engagement across the system. We really want to ensure that our engagement across the system is coherent, it's coordinated, and that the voices of citizens and patients are really at the heart of future service development and delivery. And we want to have a consistent engagement framework, which really is going to allow us to measure our successes, which will support the system to ensure that it's meeting those legal requirements that we have to now meet, and that we're really positioning ourselves as leaders nationally in the way that we do our community engagement. Next slide, please, Jane. So what's happened so far? So as Jane said, in spring this year, we commissioned a company called Morehouse to carry out an 8-week project, which was essentially identifying the principles and the goals of our new engaging with our communities framework that is in development. So they worked by initially engaging with over 80 different people that work particularly in community engagement across various parts of the system, so health and care provider staff, community and patient advocacy groups, and other system partners. And what they did was they had individual one-to-one discussions with 50 of those people, where they looked at what the current challenges around our community engagement work. Then they led 2 design workshops, each of those with 35 different people. Those were looking at identifying what's the best practice that we've got in place at the moment, and how do we want to shape the recommendations of how we might change things moving forwards. They conducted an online survey and collated that feedback from a much broader pool of stakeholders, and then focus that very much on opportunities for improvement. And then they did a desktop review, basically looking at the key strategies, policies and guidance within the system, but then also what's the best practice that we can learn from other systems, and what do we need to make sure we're doing from a national policy point of view. Next slide, please, Jane. So from that initial scoping exercise that's been done earlier this year by Morehouse, I mean, most importantly, the insight that they know is that we've got really great stuff that is happening already across the system. So just heaps of really good practice for us to build on, but essentially to roll out system wide. So the areas where people told them that they felt we were particularly strong at is utilising community participation, patient participation to develop specific services, particularly for chronic and other health conditions. And they heard from our health and care frontline staff that they are actually really truly motivated by being able to co-produce services with communities, and that there are a lot of assets already in place that can really support specific community engagement. So we've got a really strong foundation to build on to be able to deliver rapid and system-wide improvements. Next slide, please, Jane. So from that, they've looked at what we will do now in terms of learning where we could improve. So they heard that we should continue to engage with that full breadth of a variety of user groups that we already have within the system, but to really be making sure that we're including those with the quietest voices, those that are seldom heard, the underrepresented groups, and that we need to ensure that we're consistently analysing data from engagement activity, and we're actually using that data to shape our services, and that we can try and have a long-term use of data and a broad use of data, and that it's easily accessible to everybody across the system. That we need to really be robustly demonstrating more what we're doing with the community involvement and engagement activity that we're doing, and how we're using that to influence our strategic choices and, you know, really make a decision, informed decisions around our service design. And we need to be telling those who we engage with and work with about how their contributions have actually really made a tangible difference, so that they feel that their engagement is really valued. And all of this needs to be standardized and adopted across the system so that we continue to build the trust with our communities. We enhance our reputation across the system, and ultimately ensure that communities are encouraged to continue to want to engage with everyone across the system. They don't become disheartened or disillusioned by the process. Next slide, please, Jane. So what's next? Again, as Jane said, there's various things now in the pipeline, but essentially what's happening is Morehouse has set out 5 priority recommendations that will form the basis of what the new framework will be, to embed essentially effective community engagement throughout the system. So taking all of those pockets of brilliance, and making sure that it's rolled out everywhere. So those 5 priority recommendations, one's around implementing a robust governance model, which I'll come on to in a moment. One is around aligning engagement and comms activity across the system and partners. Then establishing a system-wide shared intelligence platform, so that basically everybody will have this one place to go to where they can find out what's engagement activity is in the pipeline over a calendar period. They can go and get data from various different projects, and hopefully that will stop things like duplication that can happen where we're going to the same people about the same things, and that's particularly one that became a recurring theme through the engagement work that Morehouse did. That was something that people felt they would have the most value from moving forwards. And then embedding best practice, essentially, so all that great stuff that we're doing, creating toolkits so that everybody across the system have those toolkits available to them, so that we can drive consistency and have a real cultural change in the way we do engagement across the system, and that we can pool our assets and our work. So, you know, again, reducing that duplication, stopping citizens from becoming frustrated because they're being asked the same things by different parts of the system. And as Jane said, the recommendations that have been set out there are going to the system's executive board later this month for their consideration. If those are approved, we'll then start moving on to the next steps. Each of those 5 priority areas will be underpinned by a number of actions to be able to achieve them. But the first step, and this is the bit around the governance piece, will be about having a steering group that will be able to ensure that they're strategically driving implementation of those recommendations, with very senior input across the system, and ensuring that there's, you know, real robust governance around that. But of course, we can only be successful by working as a system, so working with people right across the system, all of our partner organisations and groups, bringing everybody together. The work that Morehouse has done so is the first stage, but as we build the framework to get to the point of implementation, it's about bringing everyone together, so that we can really ensure that we've got everybody's views that have been heard and we can take things forward. So yeah, the immediate focus will be very much on those first 2 recommendations, because without being able to do the first 2, we won't be able to do recommendations 3 to 5. And really, this isn't going to be a short process. It's not going to be a quick win. It's going to involve bringing everyone together involved in community engagement across Birmingham and Solihull. And I think really we envisage that the new framework won't be fully developed, implemented and operational in terms of all those five priorities until December next year. that's it from me. Thank you, Jane, and happy to take any questions.
Thank you ever so much, Emma. So any questions from anybody on the framework, on the community engagement framework? Anything in the chat, Gemma?
Nobody's done any speedy typing yet.
Emma,
Again.
that was very clear. You know, the whole process and the next steps. That was great.
No problem, Jay. Happy for, again, you know, to share my contact details after, and more than happy to take any questions at a later date. Thank you, everyone.
That is great. Thank you ever so much, Emma. What I'm suggesting, I mean, that we've had 3 presentations, a lot of content, is just to take a break for 10 minutes. If we come back at 11:05. So next on the agenda, Steph Bloxham is going to give us an update on the VCFSE Leadership Alliance, and Chet and Kerry may come in on that. And then we're going to just have some updates around the room, and it would be really good to hear about what's working well in terms of integration, either thematically or geographically, and to begin to sort of understand the good practice that's happening across Solihull. Evan Grant from Mental Health Collective is going to give us an update, and then we've just got a few aspects of any other business. So let's have a 10-minute break, come back at 11:05, so everybody can just grab a cuppa and see you a little bit later. And thanks to all our presenters. We have the thank you, Gemma. We have the representatives, Chet and Kerry, who then sit on the VCSE Leadership Alliance, which also includes the 5 areas of Birmingham. Unfortunately, I wasn't at the last meeting, so Steph is going to feed back, and Kerry and Chet, if you want to add in, please do. So over to you, Steph.
Just
That's
before
fine.
Steph
Evan's got his hand up.
Yeah.
double check if Evans.
Yeah, I just wanted to ask Jane if I may go immediately after Steph rather than after the open house, because I think what I say will relate closely to what Steph said and also to what we heard before the break.
That's fine.
Thanks.
Yeah. Okay. Over to you, Steph.
Well, okay, so yeah, it's just to keep you updated really on the progress around the VCFSE Leadership Alliance. As you'll know, it was established or has been forming since July last year, and it is a requirement for all ICS areas to have a leadership alliance or some form of alliance for the voluntary community sector. And each area will have structured that slightly differently. We've been meeting each quarter. As Jay said, Stephen Raybould at BVSC currently chairs that alliance, and we have representatives from across Birmingham and Solihull, both from a geographical perspective as well as thematic. Recently, an additional requirement that's come through NHS England is for each ICS area to have a form of agreement between the ICS and the voluntary community sector, which is essentially led within the Leadership Alliance and with the ICB, but it is very much at that system level of the ICS and the wider voluntary sector. So that agreement is currently in draft. We had a discussion around it in the meeting in July, and we incorporated feedback from that meeting. So we'll be going back when we have the next quarterly meeting on the 20th of September. We'll be going back to the group to discuss that and to look at taking that forward through the appropriate governance within the ICS, for example, through the Integrated Care Board, the Integrated Care Partnership, and the place committees as well. So we'll be having a discussion on what that looks like to move it forward. And it's very much focused around equipment and ways of working at that level, and obviously what progress there will be around the integration of the voluntary community sector into the ICS, which is obviously very important. We had done an exercise some months ago where there's a small group of us with representation from the voluntary sector, the ICB and local authority as part of a pilot phase, which was looking at a quality development tool that's being established and is due to be rolled out from NHS England very soon. There were a number of ICS areas who took part in that pilot to test out how it worked, and it's very much looking at rating different elements, different quality areas around integration between the voluntary sector and the integrated care system. And we used that exercise really to help inform the agreement and look at what we really need to do to get from where we currently are around integration to where we want to be. So that's in a much more mature setting in the future. So yeah, very happy as obviously that progresses, we can keep you updated on what that looks like and what the next steps are, and come back with more of a presentation around that in the future meeting. Just to say as well, feedback at the last meeting was very much around we need to look at our branding and identity of the Leadership Alliance, which we will be taking forward. So at the next meeting with the group, we'll have a paper there to agree that approach moving forward and what that will look like. And obviously have support and involvement through the ICB to enable that. We'll also be looking at communications around the Leadership Alliance. So where can we hold and host information on what's happening, what that group is, the wider dynamic network, which this is part of, and information about the voluntary community sector. So again, we'll be looking at those next steps, and hopefully we will be aiming to have something on the ICS website for Birmingham and Solihull, which would be fantastic. And there was also suggestions around how we look at the structure of the Leadership Alliance since it's formed last July. Thinking about certainly probably from next year onwards, how do we want that representation to look like? What will that structure be? Will we have a more formalised approach around representation? And again, we'll be going to the next meeting in a couple of weeks' time to discuss that and agree a way forward so that we can move that along. So there's lots happening. We had some really good feedback in the previous meeting, and we're obviously ensuring that we're taking that all on board. And when we have the meeting in a couple of weeks, we'll obviously have further updates with the representatives there, who can then come back in future to have a conversation around what we're taking forward. So I hope that helps.
Thank you, Steph. Did you also have was that the meeting where you had the presentation on the 10-year strategy?
So it was the same day. So yes, so we essentially split the usual quarterly meeting, where the first hour was actually a session with Dr. Justin Varney presenting the ICS 10-year strategy, which was recorded and was open to the sector across Birmingham and Solihull to attend. So there is a recording of that on our website, which you probably will have seen, but I'll just pop it into the chat anyway, because I think it's a very helpful update, and there was a Q&A. So yeah, please do refer to that if you haven't yet seen it. And then the second part of the meeting we held as a group to go through some of those items. So yeah, thanks Jane, I'll pop that in the
Steph, it's on the presentation slides.
Perfect.
On this presentation slides. Yeah,
great.
So that's great. Thank you ever so much, Steph. Chet or Kerry, did either of you want to come in? You don't need to. Okay.
Sorry, Jane.
Yeah.
I mean, the only thing I would say is that in terms of feedback and wanting to talk to myself or Kerry, just feel free to contact us. And we will feedback to any other meetings that we attend. We haven't had a lot of feedback in the last few months. But I think we're probably hearing a lot of stuff firsthand at these meetings as well. So in terms of information, we don't usually have much more than what we've already been told. I'm hoping that in the near future that might change a little bit more, so we can start going out to people and gathering views on behalf of the sector.
So Chet and Kerry, we'll share your contact details when we put out all the information. Thank you. Thank you, Steph. So Evan, I'll try and retrieve your presentation, but bear with me.
I'll begin talking anyway, so that as the presentation is as much for reference afterwards as it is for anything else. So thanks for the opportunity to give an update on the VCFSE Mental Health Collective for Birmingham and Solihull. And I was keen to speak just after Steph, who's been talking about the overall VCFSE alliance between for the Birmingham and Solihull community with the integrated care system. And following on from Jatinder and Carol, who were talking about how that feeds down on a geographic basis into places and into localities. So we've had a good look at the overall geography from the system down into places and localities. And I'm here to complicate the picture still further, because we're now talking about the way in which this splits in a different matrix on thematic support. So if we consider Birmingham and Solihull as a system, then the system has decided to deliver mental health services through a collaborative called the Mental Health Provider Collaborative. And the Mental Health Collective I'm here to represent today was the trigger for creating it was to bring the sector together across Birmingham and Solihull to relate to the Mental Health Collective. So we're looking, if we've been looking, I don't know if this is going to work, we've been looking from top down on geography. I'm coming in sideways from the point of view of thematic support for mental health. Now, that's all pretty logical, I hope. And one of the things we have to watch out for, though, is that numbers of organisations are going to end up having to relate at thematic level, neighbourhood level, locality level, overall level. So I think as a sector collectively, we have to watch out for how we do that in the most productive and efficient way. But leaving that aside, if I may go to the next slide, Jane. So the goal of the collective is to be the community for mental health and wellbeing organisations, voluntary organisations, operating in Birmingham and Solihull. And on the next slide, we have 120 members at present. This shows the geographic split. So of those 120, 15 operate only in Solihull, 45 operate only in Birmingham, and 60 operate across Birmingham and Solihull. So in one sense, that's quite strong. We've got 75 out of 120 operating in Solihull. On the other hand, I think 15 is a little bit underweight in terms of Solihull organisations. So across the range of members, it goes from very small organisations working just in one locality or neighbourhood to the local part of large organisations, national organisations, and how they relate to Birmingham and Solihull. So I'll come to some requests in a minute or two, but bear in mind that only 15 of the 120 are dedicated to Solihull, although 75 of the 120 operate in Solihull. And when, should you get these slides, you'll see at the bottom, it says responses from 120 mental health collective member organisations. That's a link that'll take you to a spreadsheet where you can see who operates in which region. And within Solihull, divided into three sub-regions. Considering what we heard earlier before the break, it may be that we need to break it down to PCN, but for now it's three sub-regions within Solihull, and that spreadsheet allows you to slice and dice it so you can see who's who and claims to operate where. So on the next slide, please. One of the functions of the collective is to elect a chair, a deputy chair, and a panel. You see the names here on this the slide. And this elected group of 12 people form one of the committees, one of the governance committees within the Mental Health Provider Collaborative. And not only does this group form one of those committees, but it also has a representative on all of the key committees feeding into the executive team within the Mental Health Provider Collaborative. So from the point of setup and organisation, the third sector is very well wired in and connected to the Mental Health Provider Collaborative. And I would say, though, it is only set up. As we move forward, we have to take advantage of all the setup to really make a difference on to how the third sector is supported, to how the third sector, the VCFSE sector, feeds into the Mental Health Provider Collaborative and actually makes changes so that we end up with better health outcomes across Solihull and Birmingham. And one click, please, Jane. Highlighted on this. Oh, back, please.
Oh, how do I do back?
I don't know.
Yeah,
That's it. Stop there. Yep.
I've done it.
So I just wanted to highlight on that chart, Heather Delaney from Solihull Parent Care Voice and Cheryl Hawkins from Shine Youth, two of the panel members from Solihull organisations, and it was a requirement from the ICB, or the Mental Health Provider Collaborative, that we ran the election such that we had at least two Solihull members, and happily Heather and Cheryl came in the top 10 in the elections, so we didn't have to do any complex electioneering rules. But just be aware that Heather and Cheryl are the Solihull representatives into this mental health panel. Okay, and the next slide, please. So these are some short requests I'd like to make of you. I mentioned we've got 15 organisations in Solihull that are, dedicated, working only in Solihull, that members of the collective. I'm sure there should be more. The most effective way of getting more people to join is if, well, perhaps you're on this call and you're interested in joining, in which case, please get in touch. You'll see my contact details on the next screen. But the most effective way is for existing members to introduce new members. So I'd encourage everybody to have a look at the list of members and compare that with what they know in Solihull, and either give me details of people that I may contact in these organisations, or even better, introduce me to them so I can encourage them to join the collective. I'd encourage people to engage. So we send a weekly email to everybody that's a member of the collective, every organisation. I should stress it's 120 organisations, not 120 people. So that goes out every week on a Thursday afternoon. And I'm quite conscious that I got a lot more news about Birmingham than I do about Solihull. We do have some Solihull news today. We have something from Urban Herd about the youth worker opportunity they have working with ICS, and I actually picked up a couple of weeks late, but the fact that ICS had been on the Radio 4 Inside Health. But I'm generally short of news about Solihull to share with a wider mental health collective community, and I'd be keen for people to send me that news. And if you'd like to get the weekly email, please just ask. We meet as a collective 5 times a year, so that's every 2 months with a gap for the summer. And the next meeting is coming up later in the month. If you'd like to join that meeting and you don't already have an invitation, please get in touch. And then finally, please, I'm keen to hear from you what it is that I could do to help with the mental health voluntary sector to get more out of how we work with the National Health, and indeed what we do more widely than the Mental Health Provider Collaborative. So on the final slide, Jane. So there's some weird formatting has happened, but hopefully this all will work. You know my name, Mabel, and I should stress I'm employed by and hosted at Living Well Consortium, but my job is across the sector. It's not something that's a Living Well job. I work with Mabel Newman and Ren Barnes, who provide part-time admin support to the collective and the panel. And there are 3 links at the bottom. Sorry, the main email address there, MHC for Mental Health Collective at Living Well Consortium, that goes to all of us. So it's the best first email to use because I'm only 3 days a week. And if you need someone to see it, then that's the best one to use. And there are 3 links. The introduction to the collective is a 1-page PDF that hopefully summarizes what I indicated earlier. The next one, MHC-members, is a PDF with details of the 120 members. And the last one is the short online form that we ask people to complete to join the collective. So, Jane, that's all I plan to say. Happy to take any questions either now or afterwards through the contact details. Thank you
ever so much, Evan, and thank you for highlighting, you know, that need to really represent Solihull strongly. It's a challenge when we have one place and Birmingham has 5 places. I mean, obviously that's to do with geography and population, but to really be clear about what the specific issues for Solihull are, and have that representation. You were going to say something, Evan?
Yeah, I was going to say 2 things. First of all, the 5 places versus 1 place doesn't really factor into the amount of news I get. I think one reason I'm getting less news is we've got fewer members, and also, and this is work for me to do, although I'm keen to get insight, I definitely get more from Birmingham City Council than I get from Solihull.
Okay. Evan, are you connected to Carver's newsletters, eGrapevine and the Solihull? We have newsletters around volunteering and funding. Are you on those circulation lists?
Yes, I think I am, and one of my other guys is Cameron Grant Memorial Trust.
Okay.
So no, I am, yeah.
Okay, so a big call out then for more Solihull related information.
Yeah, and more Solihull members. Thank you.
Yeah, thank you, Evan. Okay, so a chance for an update around the room in terms of what's working well already around integration, or good examples of early intervention, prevention, or anything about social prescribing. When I'm in meetings about voluntary and community sector, my kind of go-to examples are the VCSE response in terms of emergency, in terms of COVID and cost of living, and that relationship to local authority in terms of emergency response, particularly around things like food poverty and how we have worked together in an integrated way. In terms of geography, I quite often reference work in Kingshurst around how the community sector, local authority and health have come together to look at community space for the community and aligning that to health and well-being. So those are the examples that I tend to draw on, but it would be really good to hear about what else is going well. As Carol said, often the voluntary and community sector is under the radar. So it would be really good to hear from people about Solihull specific examples of integration. So anybody want to share? Kerry, thank you.
Finally found my hand button and now I can't lower it. Or have I lowered it already?
Yeah, we can hear you.
Okay. I just wanted to let people know about a choir that happened with the rural PCN, with social prescribers that are in and covering the 4 doctor surgeries in rural Solihull, and Hampton Singers. And we got a little bit of funding through Solihull Council's Community Fund to fund the conductor. And it was a 12-week programme, and it was working with people and patients who felt socially isolated, that wanted to go and do a little activity, wanted to do singing, but weren't very good at singing. And I have to say, at the first week, we had people there that were really underconfident. And by the end of the 12 weeks, they all got a certificate, they got a little book, and it was absolutely fabulous to hear some of the testimonials. And over the 12 weeks, we had the social prescribers there, we had nurses from the surgeries, we had doctors taking part. So it was kind of like there were people there for people to talk to should they want to, and we're hoping to repeat that coming up to Christmas, so we can do a little Christmassy concerty thing. So I think that's where the voluntary sector and the choir and the venue and health all got together. I thought it was really, really good.
Thank you, Kerry. That's a great example. And in terms of social prescribing, because I don't really understand the landscape of social prescribing in Solihull, but I know that Citizens Advice, you do have social prescribers. So
yes.
what geography do the social providers cover with your organisation?
Okay, so CAB, we cover rural Solihull. So we cover Hampton in Arden, Balsall Common, Dorridge, Arden. And we have the equivalent of 2 full-time people working on social prescribing. So we are employed or commissioned by the PCN to deliver social prescribing. So we work directly in the surgeries with patients or wherever the patients want us. So we've interviewed people in doctor surgeries, in garden centres. We went shopping with somebody around Sainsbury's to talk to them about their needs, because they got care, that they were caring for somebody, and the only time they got out of the house was when they went shopping. So we do loads of activities. We put on coffee mornings. We're trying to do a market style event so that patients can get to know organisations that are out there and how they can help them. So we basically deal with anything that's non-medical. So if it's a medical issue, it goes to the GP. If it's a non-medical issue, it comes to us. It can be around isolation, loneliness, increasing physical activities, or it can be, you know, we need blister packs and we need a pharmacist that will deliver our blister packs to us. So we work with Rural Solihull. We also work with Solihull Healthcare Partnership as well. And we have one full-time worker that works with them on their social prescribing.
Thanks, Kerry. Yeah.
But yeah, we do lots. I could talk about social prescribing all day if you let me. We've got a tree in the library. We've got chatty benches that we've painted all different colours, and asking people to go and sit on a bench. And if you see somebody else sitting on a bench, go sit with them, because you might be the only person they talk to all week. So yeah, so lots of different activities. I'm aware though that GPS Healthcare have their own in-house social prescribers. I believe Solihull West, Age UK Solihull deliver theirs, and Gateway Family Services cover the 10 in the north. So at the moment we're working with Gateway Family Services to try and develop a sort of peer group, if you like, of social prescribers so that we can share best practice.
That is brilliant, Kerry, because I didn't understand that picture. Now I do. And that's just sounds like a lovely example. Do you do case studies of any of your work?
We do, and I see that Emma's already
she asked
asking me for that. So yeah, I will share my details, and we can share case studies. We've got lots of testimonials because we've had, I think it's over 500 people per year. And we've been doing it since 2019. So we've got quite a lot of evidence there on what works and what doesn't. Oh, and I see Gemma. Hi, Gemma. Sorry, Gemma, you're from Gateway Family Services, aren't you?
Sorry, I'm terribly rude. I didn't poor etiquette on Zoom. I didn't put my hand up, but I heard my name, so I was in. Yeah, thanks. That was a lovely explanation. You saved me a big job. I was going to get ready to go. Like you, I couldn't find the hand button for so I thought, oh, Kerry's done it. Wonderful. Yeah, Jo Harper's the CEO, and I'm covering for Jo today, but I actually oversee the social prescribers in Solihull as part of Gateway. So Kerry's done a really wonderful explanation as to what we do and our work together. So that's fantastic. I mean, I'm happy to give another example of some of the work we've done in Solihull social prescribing, if that's useful. But equally, we provide case studies, lots of things like coffee mornings, etc., group work that we do, and we're trying to look a bit about green social prescribing as well moving forward. So using green spaces more, things that are free and active and outside. And I'm really sorry if I've hijacked somebody's next point. Sorry.
You go, Gemma.
Is that okay? Thank you. And one of the things we're quite proud of or are keen to share more, other than in our own case studies, is rather nicely, I oversee the SILS Solihull Lifestyle Service as well. So part of the role has been sort of really integrating those two services in Solihull, the SILS and the social prescribing, and linking in terms of wellbeing. And we've seen some real positive influence in that, in terms of accessing things like cooking on a budget, which we're, as you would imagine in the current time, extremely inundated with requests for. Because we are a lifestyle service, but our main target it's not weight loss. It's very much shifted towards prevention and family education and so on. And obviously we've got the quit smoking service as well. So I realised that was a very quick overview, and I'm happy to give more of an update outside of this meeting, and I will post my email in here as well as Jo Harper's. But yeah, so sorry to piggyback on that, Kerry, but thank you.
No, that's brilliant, Gemma. It's really good to see the whole picture. Evan just popped his hand up while you were speaking, Kerry, but I think, Evan, did you put something in the chat that was on your mind, or do you want to come in?
I think that may have been an accidental hand. I do have a minor point of AOB at the end, but not to do with integration. And I did put a point in the chat that I know people that took part in the choir and loved it. Oh,
good. That's good to hear. Okay, does anybody else want to come in? I mean, Chet, do you want to come in around? I mean, I referenced food poverty. Do you want to say anything about that?
Yeah. So one of my colleagues, Gemma, chairs kind of the food collaborative in Solihull, the food network, and we just a collection of organisations that essentially offer food bank services. So I think the feedback from the different providers has been that food donations have tapered off quite a lot. And a lot of the focus now is on supporting those families to kind of think about where else they're going to get their food from, and how to. And it's just been mentioned: cooking on a budget, shopping on a budget, making the best use of what you have. We've seen a drop off in users directly around again, which is our social supermarket coming to collect bags of food as well. So which is nice, as long as those people are in a position to support themselves, and we've certainly been doing that with budgeting work with them for quite a while. I think that in terms of other updates, it's now been announced that Coalbridge will be running the Kingshurst Family Hub Evergreen. We've got we had some funding to deliver a community kitchen there, which a community fridge rather. So if you're not familiar with the concept, is essentially people take items that they might need and then they leave other items for other people as well. And that's been working quite well on quite a small scale, but it's the users of the Family Hub really that are doing that. There's a school uniform recycling project. There's a play and stay, and then we're working with the health services as well to deliver breastfeeding clinics, women's aid to deliver some support for obviously domestic abuse. People who've experienced domestic abuse. We've run an adult cycling session in collaboration with another local group as well. So there's quite a lot of activity going on. And in fact, my colleague Gemma today is at a meeting around Kingshurst, and no doubt they'll be discussing kind of health-related services and how that partnership will develop. So there's opportunities for other people to deliver within the family hubs, as long as it's focused on the families of those who have children between the ages of 0 and 11, because that's really where we feel we could best make an impact. And there will be something for older families of older children in the village centre. That's it really in terms of a quick update from me.
Thank you ever so much, Chair. And I believe you and I have both been invited to be part of that Kingshurst steering group, so we'll be able to.
Yes, yeah. I couldn't. In fact, I've had to excuse myself today because I've got another meeting as well. So I do actually have to leave now. So it's nice to meet you all. If I've met you before, and please do get in touch if you need to.
Thank you, Chair.
Thank you.
So Cheryl's had her hand up for some time, I think, and then Elaine's after that. So Cheryl, over to you.
Yeah, I just really wanted to highlight and praise, as Chet has done, the integration and communication that's happening around those family hubs. Bridget and Mary within public health have been really great in communicating and consulting, I think, and certainly our organisation has been part of that and are looking to deliver for teenagers around mental health and wellbeing in 3 of the hubs. So I think it promises to deliver a lot of really good integration between the voluntary sector and the health service, and to date I think our experience has been really, really positive with that. So thank you, Chair. Coalbridge obviously leading on one of the hubs as well is just really brilliant.
Cheryl, can you remind me of your organisation?
Yeah, we're called Shine Youth.
Oh, Shine Youth.
Yeah.
Oh, well, I don't know if Chet had already left when you said that compliment or not.
Oh, I can tell him directly. That's fine.
Yes, that's good to hear. In some ways, I think if we think about, there's a PCN footprint, isn't there? But there is the north, east, and west. And if we think about the north, in some ways, is easier in terms of that integrated model. It's perhaps the kind of east and west that needs a little bit more thought. But anyway, on that note, we'd pass over to Elaine.
Yes, hi, thanks, Jane. I actually wanted to talk at the time when Gemma was talking, but I had a very untimely phone call, so apologies for that. Just wanted to share that in terms of the presentation we had a bit earlier on from Jasvinda, I think, around the PCNs and the way that works. We've started to work very closely with Solihull, as they have that involvement with the 5 PCNs in the borough and the 20 surgeries to make our community delivery around menopause, the peer support, closer to the core. But we're also working with public health now with Ruth Tennant on the expert by experience arena to help shape a pathway around menopause and early intervention and prevention, really. So we've got a number of events coming up that are community-based, and we're really lucky to have had some sponsorship from a number of partners for premises, really, to hold a menopause fair later on in October. So if Jen is happy to do that, and I'll share that through Cava as well, swapping hats quickly. I'll be sharing those events and hopefully see some of you there. But what I really like is the momentum on the engagement with the formal structure around health in Solihull, with Solihull, the PCNs, and the surgeries around. So I'm talking primary care. Our involvement with secondary care is minimal at this stage.
Thank you, Elaine. Can you just say what that Solihull Health comprises then?
And well, they're actually a private organisation, which is quite strange, and I haven't managed to suss out how much decision making power they have, but they're there to oversee the communication pathways to the PCNs, to the GP surgeries, and they have two medical health hubs around, which may become the health hubs and the women's health hubs as well for Solihull, but that's probably a bit premature to say. So there's one up in the north, a building they've only just started working from, near Castle Brom, and the other one is at the Monk's Pass Health Centre. And they're quite a small team. So, and they've only been around for, I don't know, about 2-3 years, I think, something like that. Very much around collaborations and helping sort out communication issues and crisis issues.
Thanks, Elaine. That's really useful to know. Anybody else want to come in? Evan, any examples of what you would say is a good integrated working relationships in the mental health arena for Solihull?
Apologies for being left for words. And I don't have anything to add to what people have already said at this stage.
Okay. Thanks, Evan. So yeah, really good to hear examples, and it would be really good to have where there are case studies to be sharing those, because we, as a sector, we can speak about our impact and be able to give examples, because I still think we have those conversations about, the need to say what our value is over and over again. So yeah, and any examples are really positive. Rather than go back to the presentation, just to say on the last slide, there are some reminders about funding that is out at the moment. So I think the shortest deadline is with BVSC around a piece on engagement for those people with long COVID. It's the 15th of September, particularly engaging with ethnically diverse groups and people with a physical disability or a learning disability. There's a Suicide Prevention Fund 2023 to 2025 from Department of Health and Social Care, and the closing date is 1st of October. It's a £10 million grant. There is the Cost of Living Fund, working with people under severe pressure, deadline 16th of October. Amounts range from 10k to 75k. So where possible, we promote relevant funding through the network, and I know Steph quite often gives me information to disseminate, so we will continue to do that. But there are links on the last slide, and there is a link to the 10-year strategy, and there's also a link to, at the moment, the local authority is running a survey about what support voluntary and community sector most need. We're contracted Cava with the local authority. Our contract comes to an end the end of March 24. So they're looking at what a new model might look like. So if you have a chance to feed back into, what you need as a sector, what support you appreciate, please do. I believe the survey finishes on at the end of September. Evan, you got your hand up?
Yeah, that's the trigger for the other thing I was going to mention, which is it's trivial overall, but in that consultation, I noticed Solihull Council's talking about VCSEF.
Oh yeah,
it's taken me about 6 months to get around VCFSE, and for me, although it's a sense check here, for me, although it's trivial, it just makes the council look out of touch. I've never heard that before. No doubt there are examples of other parts of the country using it, but it does seem really bizarre that we apparently have to learn a new abbreviation.
Evan, I just noticed that for the first time today, and I think it's an error. But
it's not just one. It's a deliberate error, but I don't know who has the right connections. But a gentle suggestion.
I know the right connection, so
a gentle suggestion that they could just align with the rest of the world would be helpful.
I will let them know. Yeah, it's not our survey, so just to say that.
No, it's the survey that says should we keep Cava. It's not your survey.
Yeah, it is. It is. So any support, most appreciated. Elaine.
So I wanted to piggyback on what Evan was saying. I really wish that the sector would properly call itself social economy, because, at the end of the day, social enterprise, the charities, the community groups, volunteering groups, whether they are large or small, whether they're a CIC or a CIO, it's social enterprise and it's a social economy. So that would make life a lot easier.
On that note, any other questions, comments, or are we ready to go back into the sunshiny world, away from presentations? Okay, thank you ever so much. Lovely to see everybody. The next meeting will probably be around November. We do try and keep you up to date as much as we can, and there may be correspondence coming out in the meantime, but that's the plan. And Steph, can you remind me, VCSE Leadership Alliance, is that the next one?
20th of September.
20th of September.
Yeah, Wednesday the 20th, yeah.
That's great. Okay, thanks everybody. Lovely to see you.
Thanks everyone.